Well, hi folks, welcome. I'll just give quick opening remarks, and then I'll hand it over to the team at Intersex Asia. But I want to thank you all for being on this webinar this morning. We are recording this, recognizing that time differences and other challenges sometimes make it difficult for folks to participate live. So we wanted to make sure it was available as a recording. My name is Kim Vance Mubanga. I'm the Director of International Projects and Partnerships at Egale Canada. And Egale has been working with Intersex Asia. I guess we've sort of bridged over into 3 years now on a fantastic research project that was designed and implemented by Intersex Asia. And it's been a great partnership. We've been very happy to work with the team. And I'm really going to turn it over to them to kind of handle the rest of the session today, and Prashant for you to moderate. So over to you.
Great. Thanks a lot, Kim. Good evening, everyone from those who are in the Asian region. Good morning to all those who are in the Eastern time zone and US and Canada. Thank you all for joining. My name is Prashant Singh. I work at Intersex Asia as the Research and UN Advocacy Officer. It's a very happy occasion for all of us that finally, for the first ever research reports from Intersex Asia finally getting launched. And there wasn't a better day that we could select, probably given today, April 22nd is celebrated in India as the National Intersex Human Rights Day. Maybe I can give a brief background why we celebrate the day as we do. So in 2019, on this day, the Madras High Court actually passed a judgment asking the government of Tamil Nadu, the state of Tamil Nadu in the southern part of India, to pass an executive order banning surgeries on intersex children. This was a momentous judgment because for the first time in this part of the world, the subject of intersex rights was recognized in the judicial space. Otherwise, there were always used to be some passing references to intersex rights. This was the first judgment focused on the question of surgeries. And after this particular judgment, there was a lot of requirement to do advocacy to actually get the executive order passed, which required a lot of effort. And finally, we saw in August that the government of Tamil Nadu actually came up with the executive order, which isn't perfect, given it is an executive order and it doesn't have the same effect as a legislative ban. But nevertheless, it was an important step. And since then, we've been celebrating this particular day because this judgment was a particularly momentous one. And given the importance of this judgment and given how important research is, with regard to advocacy on this particular topic, we thought of choosing this particular day to launch the 4 reports. In this particular session, we have a panel of seasoned and young activists, as well as activists/researchers and academic researchers who will be, with whom I'll be conducting a panel discussion very shortly. In terms of the flow of the session, I should just broadly brief everyone that firstly, I'll invite Haikal Chu, the Executive Director of Intersex Asia, to share brief introductory remarks. Thereafter, I will broadly explain the research framework which Intersex Asia followed while approaching this particular project and generally the research approach that we have within the organization. And then we'll go ahead with the panel discussion, thereafter followed by a short Q&A. So that's how the program looks for the day. With that, I now invite Haikal to briefly set some remarks. Haikal, over to you.
Yes, thank you. Thank you, Prashant, and thank you, Kim, from Egale Canada. My role is to show the highest gratitude to all, the participants to make this happen, because this is the historical moment for us. It's our first research in Asia and especially in South Asia. That's the first separation research on intersex human rights issue. So we are very grateful to Egale Canada for supporting this, evidence-based initiative. This really helped, a lot for to build the base of our movement and advocacy for intersex human rights in Asia. And this and also I want to thank for the expertise joined today, and also the participant for to contribute to this research. Without their support, it's not possible that we can have this result. For building a better future. So thank you so much. And in the last, I want to thank all the participants who concerned about intersex human rights issue and joining this webinar. Hope that this topic, can help us to support intersex human rights to be a better one in the future. And thank you so much.
Thanks a lot, Hiker. I also join Hiker in thanking everyone who supported us along this way. This was this has been very important project for Intersex Asia, and particularly within my role as Research and UN Advocacy Officer, which I started in 2021. This is finally, things are now getting out. We're quite happy about that. And so this is right now you're seeing the 4 South Asian reports getting launched, and in the months to come, we'll also be launching the 8 reports from the Southeast Asian region. So yeah. There's a lot coming your way in terms of the research publications from Intersex Asia. So, as mentioned earlier, I wanted to describe a little bit about the research framework that we followed while conducting this particular project. To start with, when we conceived the idea of going about this research, we have to be, of course, be reminded of the regional context in which we are doing this particular project. So within Asia, there is no region-wide or a regional level human rights mechanism or an instrument or an institution, right? So that's why there is no agreed upon framework with regard to human rights within Asian countries. And therefore, as a regional organization, we purposely decided that we should approach this particular topic country-wise, and hence the decision to take up this project on a country level. Secondly, we were also very much mindful of the manner in which we should conduct this research. As an intersex-led organization, we really wanted to ensure that there's a proper participation of intersex people while drafting the research framework, as well as in execution of this particular research. So during the preparation of the research framework as well, there were series of consultations within the board members, and that's how we arrived at this particular project. The idea was that in some countries that where there is a strong presence of community there, where there is organized community there, we will be carrying out the research in 2 stages. In the first stage of the research project, basically the approach was that we would engage a national level researcher because they are much more knowledgeable about the national level context, about the human rights situation in the country, and it's followed by the second stage in which there will be a consultation organized with the community members. The idea is that the first stage of the research, which basically is aims to conduct a literature review, conduct interviews with key informants. The idea is that insights gained from that first stage of research will be tested during the second stage of the research, in the sense that how much does the outcome of the first stage match with the lived experience of intersex people. So with regard to the second stage, we are quite happy that at least we were able to conduct community consultation in India and Nepal, because there is a stronger organization present, India, Nepal, as well as Bangladesh. There are stronger organizations present in these 3 countries. Unfortunately, we weren't able to carry out the community consultation in Pakistan, given the community is relatively less organized. However, Mehrab really tried hard to fill that gap by conducting extensive interviews with all the community members possible. So in a sense, we certainly incorporated community's perspective, within the report. So that's broadly how we conducted the research in terms of, broadly it was divided in 2 stages. I should also mention something a little bit about the Asian Intersex Statement. because it is the guiding framework for Intersex Asia in all its programmatic activities as well as in its research. So very interestingly, parallelly, while we were conducting this research project, we were also in a way rethinking, revisiting the Asian Intersex Statement, which was adopted in 2019. So finally, the second version actually came into being in 2023, but we did have a draft version of the statement, and that is what acted as a guiding framework for all the researchers. The idea was that, first of all, the Asian Intersex Statement is the first document which came from the community, laying out, it's the most comprehensive document with respect to intersex human rights in the region. It is basically a compilation of all the demands of the community and what are its expectations from various stakeholders. And thereby, in the revised Asian Intersex Statement, we divided the list of demands into several thematic areas. And all the country reports which are being launched today, you'll see that the analysis has been done as per those thematic areas, and they try and cover all aspects of lives of intersex people, ranging from protection of bodily integrity to access to health and education, to legal gender recognition, to inclusion in emergency response measures. So there was a range of thematic areas which we tried to cover. And our recommendation to all the researchers was that they approach this topic by always keeping in view the community at the core of it. So therefore, we certainly ensured that there were consultations done during the first stage of the project as well. The idea was that this is the first ever document written from a human rights perspective for most countries, actually. We certainly wanted to cover the whole breadth of issues. However, in future, we would like to get more specific into the specific thematic areas, whichever becomes more relevant to each of the countries which are covered here. So right now, the idea was that we will try and see what is the legal and policy situation for intersex people with regard to each of these thematic areas. Try and look at those particular legal laws and policies and benchmark them against the best practices, adapted across the world. And finally, also share certain recommendations with respect to each thematic areas. So each of the researchers have, done this job in an amazing manner. We have two of them joining us today. Dr. Abhyata Das and Dr. Mehra. And it was all done with the guidance of all intersex activists. So we have Isan Regmi from Nepal, who is the Executive Director of Campaign for Change, and also a board member of Intersex Asia. And then we also have Maimoon Akhtar here. Maimoon is a co-founder of Intersex Bangladesh and has been a fellow at Intersex Asia as well, and has been continuously working for the past 2 years on intersex rights in the country. With respect to Dr. Arpita Das, currently a lecturer in Australia, Arpita completed her PhD on this particular topic itself and has been associated with this particular issue for quite some time. Dr. Mehrab is a well-known activist and researcher based in Pakistan, has conducted advocacy and research on transgender rights as well as intersex rights. So this is the panel that we have, and I'm really excited to start the discussion. If there is any query from the panelists before I start, any questions? No? Okay. So I thought I will start with Isan. So Isan, you've been in intersex activism for more than a decade now. And you have yourself carried out or commissioned research within Nepal on intersex rights. I wanted to understand, because this is a big occasion for the movement within Nepal as well as the region. How important how did you feel that this gap in the research impacted your advocacy, and what do you think will change after the launch of such kind of reports?
Yeah, thank you, Prashant. Namaste, everyone. I have been in the movement since, I think, since 2011. And I started the movement from my personal experiences, right? Because there was no any document to learn about the intersex human rights and to share these things with the like various stakeholders like policymaker, government, and like various institutions. Since 2016, we from our organization in 2016, we even didn't have any document, and we didn't know the exact issues of intersex individual. And since then, we try to develop some like materials to educate the people, like larger audience, because in basically in South Asia, intersex individual often understood as a transgender, and sometimes the legal document made by the government, and now they are practicing to developing the document for the LGBTI population. They club the intersex within the trans like umbrella, right? Like within the transgender term. So that is things is still happening in South Asia. That's why we need the resources to educate the people and to advocate the like human rights of intersex individual in the region. And Campaign for Change, before Intersex Asia Research, Campaign for Change also conducted the legal gap analysis, right? That research report supported the Campaign for Change for their advocacy areas, and it is like um, very basic one, and we need the resources where we can identify the needs and identify the issues and challenges of the intersex individual that we can use in various platforms for the advocacy and lobby, not only in the national level but also in the international level, right? So that is the research report is very crucial document to provide the sense of intersex human rights in the ground to the policymaker and to the other like stakeholder. And after this report, there is also like prevailing narrative in the medical field that often pathologize the intersex individual, right? Still, there are many intersex individuals have been facing non-consensual medical surgery, even in the society. Like being intersex, the general perception is that being intersex is the course of past life in the basically in South Asian region. That is why this like research report is very crucial document for the intersex human rights. Of course, intersex like Campaign for Change will use this report for the advocacy. We already started to use this research report to provide the government agencies, policymaker. That's why now it's kind of like legal progress in Nepal. Recently, Kathmandu metropolitan city develop the guideline for the child rights protection, and we use the information from the research report, and it's already impacted for our advocacy, right? They mention the intersex issues in the policy, and of course we the Campaign for Change, and I personally raised the intersex issues in the like international forum, right? Like CRC and CEDA. At that time, I started to raise these issues in UN mechanism in 2016. At that time, there was no like document to to make the reference for the intersex issues, and now we have the research report, which will help um, to make the reference for the intersex human rights in various platforms. Yeah.
Oh, thanks a lot, Ethan. It's great to know that it's already being utilized for advocacy purpose. That was the ultimate objective, actually, of our research initiative, that it is able to support the advocacy efforts of intersex activists and organizations in the region. Yeah, maybe now I need turn to you, Maimoon. This one theme which Ethan, raised in his remarks regarding the conflation between transgender rights and intersex rights, and how does it basically have an impact on intersex issues. Within Bangladesh also, this issue is very much alive. There is a serious confusion between, within the definitional clauses of laws and policies regarding trans intersex. So how do you think, how are you seeing the impact of this particular confusion within the Bangladesh context? Are you able to hear us? Hello? Yeah, go on, Memu. Okay. Yeah. Mamun, your voice is not really clear. Maybe you can try logging in again. Meanwhile, I'll turn to Mehrab maybe. So Mehrab, like I mentioned earlier, I mean, even though we weren't able to conduct the community consultation in Pakistan, you still managed to, interview a lot of intersex people within the country, and you yourself have, are an activist. Can you reflect a little bit about the importance of engaging with the, community members in developments of research reports like this, and how does it basically affect the advocacy efforts which will be taken thereafter?
Thank you so much, Prashant, and I hope that I am audible. It's quite hot in Karachi today, and I have my fan on. So people who are from Pakistan and India would know what a fan is. I'm very glad that I was able to partake in this particular research, because this research happens at a very politically contentious time in Pakistan. Fascinating that we started doing this research and exactly a few months after a law was tabled in the Senate of Pakistan, which is the upper house of the parliament, misleadingly titled the Intersex Persons Protection of Rights Act of 2022, which I go on to extensively cover in the research report as well. And this research happened at a time in Pakistan when a false transgender versus intersex dichotomy was being popularized by the religious right wing and the gender critical movement within Pakistan to discredit the transgender rights and the larger LGBTQIA plus movement, which doesn't even exist to begin with. It's only a transgender rights movement. And the narrative went that intersex people are natural, transgender people are hence we support intersex people, but we don't support intersex person. This may sound amazing and fine that, okay, at least my rights are being protected. I don't really have anything to lose. But this movement was quite insidious because it actually did not protect any of the rights of intersex individuals while claiming that it protects the rights of intersex individuals. The most fundamental of which is the right to self-determination of gender identity. And what this law basically purported was that a 5-person medical team should be constituted at the district level. District is an administrative unit in Pakistan, that a 5-person medical team should be constituted at the district level. And mind you, there are like over 500 districts in Pakistan. So you are looking at 500 multiplied by 5. And these 5 doctors are supposed to be a male urologist, a female urologist, a male surgeon, a female surgeon, and a psychiatrist. And as we all know, I'm pretty certain there are not 500 multiplied by 5 female urologists in the country, or even male urologists in the country. And the idea went that if this law is passed, any person, like a whistleblowing or like a witch hunting exercise, go and nominate another individual as intersex. And then according to that law, it is mandated that that intersex individual be paraded in front of this 5-person medical team, who will then examine him or her or them, and then vote on what gender should be assigned to this person from the male-female binary. And because it is a 5-person team, it is an odd number. Eventually, one gender is going to win over the other. And this is intersex rights. This is the support for intersex rights that this gender-critical, transphobic, quote-unquote pro-intersex rights movement was basically lobbying for. And this is all codified in law. This law has been tabled in the Senate. It was sent to the Subcommittee of Human Rights. It passed the Subcommittee of Human Rights. And there was the rhetoric that was being used to promote this was just so insidious. And the irony is that Pakistan, like other South Asian nations, particularly Bangladesh and India and Nepal as well, we have a vibrant Khwaja Sara Hijra community. The names vary in different countries, but of course, Hijra and Khwaja Sara is an overarching term that we use. And as a result of that, a lot of people either assume or falsely assume that Khwaja Sara people are intersex people, or that a lot of the times, whenever you are translating something in English, you mistranslate Khwaja Sara as intersex. And this movement, this transphobic movement, deliberately jumped onto that rhetoric. And there are statuses upon statuses on Twitter and Facebook where these people are saying that Khwaja Sara means intersex. That intersex is literally the English translation of the word Khwaja Sara and Hijra. So this research, this is the context that I wanted to place, so that my research for Intersex Asia basically happened at this particular time, when this is what was happening in the corridors of power. And in popular rhetoric and in popular discourse, this is the sort of disinformation and misinformation that was being put out. And none of this was without cause and effect. All of this was coming from somewhere. Of course, I traced its linkages back to the global gender critical and the far right movement as it is sweeping across the globe right now, with transphobic legislation being moved in the US, to gender critical and frankly transphobic statements coming out from the Prime Minister of the UK, Rishi Sunak, and the former Home Minister, Ms. Patel, to once again transphobic and queerphobic rhetoric coming out from the Bharatiya Janata Party in India. And it's in a very similar breadth, we are seeing that happening in Pakistan as well. So it's fascinating how the transphobic, queerphobic, homophobic, misogynistic, anti-privacy, anti-human rights gun is being loaded, put on the shoulders of intersex individuals, and being targeted towards all the individuals within the LGBTQIA plus communities, as well as upon intersex people, while claiming that we are supporting intersex rights. So to answer your question, how does this link to advocacy? How does this not link to advocacy? When this entire machinery is designed to usurp the rights of intersex individuals, and along with them, all other individuals, while feigning posterity and while feigning a holier-than-thou attitude. So when I was interviewing intersex individuals, all of them were mortified. They were mortified at the implications of what this law is going to have for them and where this country is going. Because in 2018, when the Transgender Persons Rights Act was passed, which has its fair share of problems when it comes to protecting intersex rights, but it's still a step in the right direction. When that law was passed, Pakistan was the most progressive nation in the Islamic world. It was even leading India by at least 10 years when that law was passed. And now in 2024, it looks like we are back to 1972, or we are back to the colonial times. So everyone was mortified. And that fear is quite palpable and tangible because intersex persons also do not really have a sense of community. I mean, gay men are always going to organize around sexual intercourse or sexuality. Trans women are going to organize around gender identity. What do intersex people organize around? There is no cultural marker that has been given to the intersex community or individuals, or to intersex individuals, so that they can then go forth to constitute a community around that cultural marker. And all of these issues, like these determinants of community solidarity, are lacking. So it's just one intersex individual sitting at their home, going to university, consuming all this disinformation and misinformation about themselves, looking at all the negative political rhetoric that is happening in the country. And the fear is increasing by mercurial leaps and bounds. And that's just a very, very tragic and sad reality. So this was the context in which this research was conducted. And these are my emotions that stem out of it. So let's see where we go forth from here.
Yeah. Thank you. Thank you for sharing this. It's of course very, very concerning that this debate or this perspective, this gender critical transphobic lens, which is now spreading all across Europe and the Americas, it has also reached Asia so quickly. We were hoping that we would, of course, there will only be we'll only be going forward with positive developments. But yeah, it's very concerning what was happening in Pakistan. And we also find similar developments in a way happening in Bangladesh. Maimoon, maybe I'll come back to you again. Are you able to hear us? Maybe unmute yourself. Maimoon, can you hear us? You're still on mute. No, we can't hear you. Yeah, maybe we'll come back to you again. Please try and rejoin maybe. We really want to hear about the situation in Bangladesh because right now the reason why I'm really insisting on getting Maimoon's opinion is that Maimoon and their organization is currently advocating for ensuring that intersex voices are included in the current law which is being drafted in Bangladesh. In a way, Bangladesh is headed towards, headed in the same direction as India and Pakistan, and probably going to repeat the legislative mistakes which were made in drafting the Transgender Persons Act in these two countries. And Maimoon's organization, Intersex Bangladesh, is working extensively in a very, very challenging circumstances. They're trying to, reach out to government officials and make sure that intersex people are also included, something which was just not done in India and Pakistan. Hardly any intersex activists were at all included in the drafting of the Transgender Persons Act. And also it, in a way, ties to the lack of research also on this topic and lack of available material. Yeah, maybe now I'll turn to Arpita. First of all, thanks a lot for staying up so late. Arpita is joining us from Sydney, and it must be 10:30 or 11 p.m. over there. Thanks a lot, Arpita. We are really glad to hear that your PhD was you finally completed your PhD. We are hoping that it gets published soon, and we all get to read it. I just wanted to, because you are working in an academic institution and you completed your PhD recently. I was hoping that you could reflect a little bit about the developments which have happened in the academia in the last 4-5 years. We've been saying this all along, that there is such serious dearth of literature on human rights. So can you share a little bit of some examples from your own experience of working on intersex issues in India, and also what you're observing in Australia, how increased research on this topic has translated into real reforms in the law and policy space? So yeah, if you could reflect a little bit about the environment in the academic spaces.
Sure. Thank you, first of all, for giving me the opportunity to author the report, but also be a panelist on this presentation. Congratulations also to Intersex Asia and to Egale for launching the reports, which is, I'm pretty sure it's a very humongous task to get these reports for the very first time in all these 4 countries, and then from Southeast Asia as well. So I'm really looking forward to reading all the reports from different country contexts, and it's a pleasure to listen to all the panelists over here. Thank you for the question about research and within academia. There's a lot of work happening in Australia, which was one of the most important reasons why I wanted to do my PhD over here, because there was so much of activism around it, and there was a lot of interest and a stimulating environment to do research on intersex rights in Australia, and it was also inspiring to learn from that work and be able to translate that into my work in India. I wanted to focus a little bit on research in India. So there is very little scholarship, as we all know, on intersex rights in the region in South Asia and Southeast Asia. And it's in my interest. I'm really invested to see this field grow, not just for myself. I mean, I'm a small bit in this bit of emerging researchers on intersex rights, but ever since I started work on intersex rights in the region, I realized that there was one, very little scholarship. Second, there was very little awareness amongst people in general, but also sometimes even medical professionals, because they tended to make the same kinds of mistakes that you expect general populations to make. For example, the confusion between trans and intersex also existed quite a lot with medical professionals as well. And that's something that needs to be corrected. What I would like to recommend for sure within the space of research would be more collaborative work, which is also what I observe in Australia and in other global North contexts. I think the way forward would be collaborative work between researchers and activists and nonprofit organizations to think of interesting and creative ways to make spaces available for intersex people and for families of intersex people to exchange ideas, to learn from each other, and to create different forums. And that's something a lot of the medical professionals, while they were talking to me as part of my PhD research, mentioned quite a bit that they would like more associations of the sort where parents could talk to each other and share information amongst each other. And also the intersex adults and families that I did speak to, they also spoke of similar kinds of concerns. So I think what researchers and activists such as all of us over here could do is have more collaborative work that is sustainable and that actually helps intersex people in awareness generation about, one, of course, the prevention of unnecessary surgeries, but also other areas of removing stigma and discrimination against intersex people to be able to live lives in a full and holistic manner, to be not bullied. And all of those have to work simultaneously with the prevention of surgeries, which we are hoping it would be nationwide and also region-wide. Thank you.
And there's some news on that front, Arpita. Thanks a lot. There is a petition currently pending in the Indian Supreme Court, and the court has actually issued notice to the government to reply because the petition actually calls for a nationwide ban on intersex surgeries, and I'm associated with this particular case in a manner. There's something that you mentioned about the lack of awareness within the medical professionals as well. So as the only medical doctor on the panel, Mehrab, I'll turn to you. There is this serious gap, communication gap between the human rights community and the medical professionals community with regard to this particular topic. And in a way, these conversations are happening in two completely separate spaces. Medical professionals have their own understanding of intersex issues. The terminology they use, the framework that they use is completely separate. The human rights community or the community, intersex community uses a completely different lens to look at it. Do you see any hope of these two separate, sections ever coming together? What would be the bridge which will join the two? Basically, I'm trying to understand if within the medical curriculums there is a scope for incorporating this language. In whatever limited interactions that I've had with doctors, they've always been insisting that, right to bodily integrity is something very dear to us. We hold it very important and all that. But when you see how it translates into practice, it doesn't really appear so. So yeah, I'm just looking for some perspective from you, if there is at all a possibility of these two, fields coming together.
Prashant, as I highlighted in my research report for Pakistan as well, that when I was going through the literature that has been published on intersex persons and on intersex conditions, it's pertinent to point out within which discipline of the medical epistemology or the medical curriculum is this housed. And predominantly, most of these studies were coming out of pediatrics. which is children's medicine or child medicine. And that is where the crux of the issue basically arises, because the medical industry, as I would like to call it, is uniquely positioned. It is not only answerable to in a manner, or has to face the human rights community, which doesn't really engage with it that much. It also simultaneously is a service delivery provider. We can also think of it in terms of economics, where we have a demand and we have a supply. And I would like to say that the medical community is the supply side of the demand supply curve, whereas the parents of intersex children are the demand side. So the demand side is demanding that our child be fixed, that there is something wrong with our child. And to just quickly go on a tangent to come back, this idea that something is wrong with the child is openly and brazenly being popularized by the transphobic gender critical lobby in Pakistan by openly stating that intersex people are sexually disabled. This is a term that was used in the law that was tabled in the Senate of Pakistan, as well as the vernacular that has been used by conservative politicians in Pakistan. They have literally used the term in Urdu. They use the word nuks. Nuks means a fault. And in English, they are using the word sexual disability or infirmity, infirmity to the genital organs. Now, what do you do to a disability? We do not have the disability discourse in Pakistan where, okay, if you do not do anything to the disability, you change the environment. Because a person is not disabled, it is the environment around them that is disabled. It is the environment around them that is maladaptive, that is not accommodating the needs of this unique individual, or the environment is maladaptive so that it cannot adapt to the needs of a diverse range of humanity, and it only conforms to the needs of one specific type of humanity, which is the majority. This discourse isn't really present over here. So as a result, the problem is always positioned onto the anatomy or onto the child, and it is the child's body that must be fixed. That body must be made to conform to the sexual binary in one way or the other. Now, on top of the sexual binary, we also have patriarchy. So if there are only two conditions in this mathematical scenario where one is a 1 and the other is a 2, and you have an individual that is a 1.5, and you must fix that individual from 1.5 to something, you would ideally want to fix the child to a male body. And that is the direction that most people take. And as a result of that, going back to my starting point, the literature that I unearthed from medical documents in Pakistan predominantly was not even on the human rights of intersex children. It was on how to fix an intersex body into that of a predominantly male body. And this is being published in 2022, 2021, 2020. I looked at literature only for the last 10 years so that it is contextually relevant. So when you ask me the question, and I'm sorry for reducing and like summarizing your question, I'm summarizing your question, what's up with the medical community when it comes to intersex people? Well, this is what is up with the medical community. They are still fixing intersex bodies into the male-female binary, and specifically to make them go towards the male. And the parent's consent is assumed to be the child's consent. That is just how it is going. And no consideration is being given to the fact that an intersex child may grow up and choose a gender that is markedly different from what their parents were suggesting or what the medical doctors were suggesting, or the gender that were assigned to them at birth. So it's within this context that the medical community sees itself divided. Now, coming towards the change part, is this possible? I do think it is possible because the medical community is still centralized. There are medical authorities, for instance, the Pakistan Medical Association and the College of Physicians and Surgeons Pakistan, which designs the curriculum for residency and for pediatric specialization. And there needs to be engagement with these two organizational bodies and collectives within the medical fraternity so that we can bring about a change in terms of just how to approach bodies that are intersex, as well as how to approach the concept of human rights for children. and gender determination and sex determination. These conversations are definitely possible. They need to happen. And I think this is where the critical gap for resourcing and financing and making sure that the right organizations are doing this really needs to start happening. So I do think it's a possibility. Is it being done? No. Can it be done? Absolutely, yes.
I'm glad you ended on a positive note and gave us some hope that this is possible. In the months to come, Intersex Asia is actually planning to work in this direction, particularly because there is this major divide between the medical professionals community and the human rights community. In contrast, since this is India's National Intersex Human Rights Day, I should mention that there was a great deal of support from medical professionals within India, and that was the primary reason why we were able to actually take on the the medical establishment within the state of Tamil Nadu. There was very senior pediatrics and medical geneticists who came to our support, and that's how actually we were able to get the executive order passed. So there is the possibility there are medical professionals who are increasingly becoming allies of the intersex community. So I hope that that gap within the terminology and the knowledge actually can be bridged. Maimoon has tried to join again. Maimoon, can you hear us? Please unmute yourself. Sorry, your voice is still not clear. Can you try that again? No. Sorry. Yeah. So your voice is just not clear. Maybe try and turn off the camera and speak once.
Around that is disabled. It is accommodating the needs of this unit so that it cannot adapt, it only conforms to the needs of one specific time present over here. So as a result, child, and it is the child's body that must be found in one way or the other. If there are only two conditions in the
Maimoon, do you want to mute yourself once, please?
The child to a male body. And that is going back to the
for some reason, we were hearing Mehrab's voice.
This has been published in 2000. I looked at literature only for the last 10 years. So, and I'm sorry for reducing what's up with the medical community. I think there's a major lag.
Yeah, there is a major lag actually. Oh my God. All right. I wish Maimoon was able to speak. Actually, there are lots of concerning things happening in Bangladesh at the moment. Just in the last year, we've seen there's a specific department on DSD which has been established in a prominent hospital of Dhaka, and they are brazenly advertising about the success of establishing such a department. So yeah, certainly that the conversation thread that we were on earlier is very much relevant in the context of Bangladesh, and that's one of the primary reasons why Intersex Asia is actually attempting to build this bridge between medical professionals and intersex community. Eason, if I can come back to you, you've conducted research from within your own organization as well, and this is another report which has come out from Intersex Asia's end. Is there any one particular theme that you would highlight that actually was a new finding for you, or which is going to which actually had a major impact on your programmatic activity or your advocacy? Is there anything specific from the report of Nepal?
Not only specific information from the report, but we will like research report will help us to for the advocacy and the awareness raising, right? There is some of the government, we have a different layer of the government, right? Some of the government have been trying to develop some legal progress, right? Making like drafting the some policy and laws and regulations, and they have been putting the information um, of the sexual and gender minority. Sometimes they don't have the clear understanding which term or which issues need to put which place, right? And this is the this research report will help us to um, educate the people. Like it's about the awareness raising, right? We can use this report for the awareness raising, because we still don't have the visibility of the intersex individual. Some of the parents, they are they are afraid to talk about their child issues with other areas, and this report will help us to we have been doing the different kind of sensitization program in various level, right? We are picking the information from the research report to educate the people. Now we have the research report, so this is the findings, and this is our issues you have to understand. So these are, now we are already practicing for our advocacy and the awareness raising, not only specific information but all the information. It's very important for us, because I already mentioned we didn't have any resources to cite the information and to make the reference from the document, right? That's why this all the report is very important for our advocacy, awareness raising, and it is basically in the policy making. It's still they have the confusion between trans and intersex, right? Sometimes now there is the trans individual have the more visibility in South Asian context than the intersex individual. Sometimes the policy maker, they think the trans issues is the intersex issues, and intersex issues are the trans issues, right? And now they have been talking about the HRHR issues of the transgender populations, and it's HRHR issues is accessing the hormone therapy and medical trans affirming affirming surgery, sometimes it's against to intersex individual. That's why its research report will help them uh, to educate the intersex medical professional and policy maker to have the clear understanding on intersex human rights issues.
Thanks a lot for sharing that. We're sorry that we are not able to hear from Maimoon directly, but there is Maimoon has certainly shared a text. Basically, in November, Maimoon is sharing that in November 2021, the Banga Bandhu Sheikh Mujibur Rahman Medical University, which is the most eminent institution, in Bangladesh, they started this particular department called the Department of Disorder of Sex Development for the treatment of intersex children in Bangladesh. Through this, they have announced that intersex children can be transformed into full-fledged women or men through treatment. Now, this is exactly what I was referring to earlier, that even though there are changes which are happening within the medical community, which is slowly moving away from disorders of sex development terminology to probably differences in sex development terminology, which is not perfect, which is problematic in itself, but still it is a improvement on the earlier terminology. But in Bangladesh, it is still being utilized. The 2006 consensus statement of pediatrics, based in US, who actually made sure that this terminology is mainstream. I would like to now turn to the researchers, maybe, and it's a question for you both, Arpita and Merab. In your respective reports, you have shared several recommendations. In addition to medical professionals, which is that one particular stakeholder you think which is very critical, to with whom we need to advocate more, with whom we need to engage further. Of course, we all agree that we really need to focus on the medical community and engage with them and ensure that human rights terminology and frameworks are being utilized. But in addition to doctors, which is that one particular stakeholder group which you think is very much relevant for intersex advocacy? Anyone can go first. Yeah.
Yeah, so as I was suggesting earlier, I think it's important to work with medical doctors, yes, but it's supremely important to talk with families because they're really, really confused about when the diagnosis happens. There's this whole medical emergency or a psychosocial emergency that's put into place, and people don't have avenues to get the right kind of information about what are the do's and the don'ts and what are the kind of impacts that it's going to have on the children. And to say that medical professionals are not like a homogenous community. Of course, there are some people who have very good intentions and work with the best interests of the child also. But in terms of like families usually go by what the doctors are saying. There is no other avenue left for families to work with. And I think having more awareness generation, not just amongst families, but also social workers who can then work with families and children to alleviate some of the concerns, to answer some of the very quick questions that might emerge, might help a long way in also families not wanting those kind of surgeries, because as was pointed out earlier, it emerged in my research also that families did want such surgeries. But that's also, we have to understand the systemic context or the structural context within which such demands happen. The preferences for male reassignment that happen within the whole patriarchal context in which we live in. So I think awareness generation with different stakeholders like parents and maybe social workers, in addition to doctors, would be great.
Thanks a lot, Arpita. And since you missed the opportunity, maybe I'll plug your recent publication on this topic. Please read Arpita's recent paper on, how important it is to engage with social workers to ensure that parents of intersex children get the right kind of information. Merit, maybe you would like to go next. Which particular stakeholder you would like to prioritize?
I'll talk specifically in the context of Pakistan, and I think this is also applicable to other nation states within South Asia as well. And I would like to say that we need to work with the religious community. And by that, I specifically mean how the religious faculty is organized. When it comes to Islam, like Christianity, is a very denominational religion. So there are, of course, different sects within Islam, and each is organized. It has its own central base somewhere, and it has its own operating framework. Then they operate through mosques, and there is one central leader of each mosque. And I do believe that instead of consistently being at unease with the religious community, there is precedent that if we approach them before the political conservatives do, there are usually good results that come out. Because then there is some ice breaking that happens, and they do not feel or sense that this is some anti-Asian, anti-Eastern, some Western lobby coming in with their vested agenda to undo the local values of Eastern societies. And this is rhetoric that is extremely common in India and in Pakistan. I mean, the Hindus use it, the Muslims use it, everybody uses it. So what it does is it breaks that ice, and it allows you to approach these individuals with your understanding of what should happen. And then you can meet them somewhere midway where they can come to you and they can tell you, well, this is what we think religion says. And you can somehow get to a common point, a point of common understanding. It may not be entirely in line with human rights thinking, but of course, it's not, the end point is also not going to be entirely out of line of human rights thinking as well. And reaching that common consensus is crucial and critically important, because otherwise you risk being harassed or flat out stopped if the religious community hasn't been engaged with. And I think that's a detriment. So although I am a big proponent of secularization of national level politics, however, religion and faith plays an incredibly important part in the everyday lives of Pakistanis and Indians and Bengalis and Nepalese people. So engaging with these faculties freehand really helps you ease out the creases in the later stages of your advocacy campaigns.
Yeah, absolutely. Thanks for pointing that out. And this is something which has been actually missing in the advocacy initiatives of intersex-led organizations. Although we have been seeing an increasing amount of influence coming from faith-based institutions and organizations. Very recently, I can share the example of the resolution which was passed in the UN Human Rights Council. There is a very clear lobby that you see that of states which are being influenced by religious groups, and this is actually affecting the narrative which is being shaped on intersex rights. So certainly this is one particular stakeholder group that we really need to reach out to, and we haven't been doing it so far. And particularly in the context of Asia, it's very much relevant. It's very much relevant in Southeast Asia as well, where one of our board members is actually actively engaging with faith-based communities to ensure that there is a simplified procedure for legal gender for recognition of intersex people in the law in Philippines. So we have a lot to process in terms of the stakeholders that we need to reach out to. Before there are lots of attendees who are watching this webinar, and for that we have to of course get into the Q&A part very quickly. Before that, I'll just ask the last question probably to all the panelists. In the reports that we have tried to cover a range of thematic areas, and as I mentioned earlier, at Intersex Asia we would like to narrow down to one specific thematic area in terms of our next focus. So I would invite all of you to share your perspective as to which would be that one specific thematic area which you see becoming more relevant in the coming 1 or 2 years, which Intersex Asia should really focus on from a research perspective. Yeah, we can go one by one. Probably, maybe you can start, Eason, in Nepal, which is that one particular thematic area that you would like to really zero down on.
Yeah, in Nepal, I think we should focus for the like unnecessary surgery, and simultaneously we also need to focus for the legal change, because Nepal government, like different layer of the Nepal government, have been drafting and making the different kinds of laws and policies. It's really a need to focus to advocate our issues and make the inclusive laws and policies. We already have been doing that. So yeah, these things from the report we have to, because in Nepal medical society is not that open for the intersex human rights issues. Still, many intersex individuals, not only intersex individuals, but intersex like adult who have the intersex variation, they are also facing the unnecessary surgery, because the idea is to to fit in the binary notion in the society, right? If there is the intersex variation, and they will not have the proper life in the society, something like this. This is the understanding from the society, like general perception. That's why many intersex individual also want some kind of surgery, because all the societal structure are not inclusive, like friendly for the intersex individual, right? Like example, if the intersex like some of the intersex individual, they identify as a man, and they have the issues, they are facing the challenges to use the public toilet, because being a man, they have to pee by stand, right? These things, it's like seems very small, but it affect the life of the intersex individual to use the like to use the opportunity from the government and the public spaces. That's why some of the intersex individuals, they want to fix themselves, and doctor are not ready to provide the full information. They purpose to have the surgery, because in Nepal there is no medical guideline and protocol, even though there is the like LGBTI has mentioned in the constitution. Some of the local level, like some of the government have been mentioned intersections in their policy laws and policies, right? Even though there is no medical protocol and guideline for the surgery, intersex individual who want to have a surgery, and a parent of the intersex child, they want surgery for their child, and some of the doctor ask the lot of money, right? It's related to the financial benefit. That's why we have to focus to educate the medical professional. And yeah, we have some of the government document are very beautiful in terms of the inclusion, but sometimes there is another part, it's totally lacking from the human rights perspective. Yeah.
Thanks a lot for sharing that. Yeah, we certainly need to focus on legislative ban on unnecessary medical interventions. It's a very, very tricky legislation to draft. Very few handful of countries have attempted this. And as per the Intersex Legal Mapping Report, which I encourage everyone to read, published by ILGA World, you would see that there are 7 countries only which have a legislative enactment, out of which only 2 have specific punishments if, let's say, surgeries are conducted, without following the exact procedure. So that's a very tricky area to work upon. Yeah, maybe I'll turn to Arpita.
Yeah, so just very briefly, I think in addition to what Isan was saying, I think a multi-pronged awareness generation strategy with different stakeholders, be it medical professionals, be it families, be it social workers, or organizations which are working on gender and sexuality in our countries. I think there's a strong base of such organizations which are working on gender and sexuality, and we should work with them to create more awareness.
Certainly, there's a lot of scope for building on building partnerships with parallel human rights movements, which are already quite empowered in this particular region. Yeah, Melab, what would be your recommendation with regard to our future focus on any specific thematic area that you would like to suggest?
Extremely stereotypical for a doctor to be talking about health, but that's the thematic area that I would like to focus on. And I believe that Intersex Asia as a regional body can really help us all get there by bringing in the technical expertise and resources to enable country partners in engaging with the medical fraternity en masse in our respective countries. I think instead of having a scattered approach where we try to do 10 things at once, we should have a very focused and targeted approach. We should target the stakeholder in each country that we think is the most primed for action and activity right now. In Pakistan's case, I personally believe that is the College of Physicians and Surgeons Pakistan and the Pakistan Medical Association. So having a technical dossier or a technical documents or a technical pathway like stepwise, based upon which we can first start an initial consultation process, leading to a workshop, leading to a proposal development and guidelines development, paced out over 12 to 24 months. I think that is going to have a very good effect. But this is not going to happen in isolation because, of course, we are talking about medical policy and health policy. This also needs to be simultaneously coupled with legal protections, in which case we should be engaging provincial parliaments, which are the state legislature or the federal legislature. So I think this is something that Intersex Asia, and particularly in the context of Pakistan, needs to be targeting, that these two stakeholders, that is the legislature, and within the bureaucracy, that is the medical fraternity, they need to be targeted as a two-pronged effort for maximal impact. I might be entirely incorrect, but based upon my somewhat 10 plus years of experience, I believe that these two stakeholders are the most primed right now for action.
Certainly, I mean, access to healthcare is a big challenge for the community. It has come out in multiple studies, and it affects the daily lives of an individual. Particularly, it came out in a major way during the pandemic. And we saw the reports of various regional level organizations how access to healthcare was particularly challenging for intersex people, given their past experiences, given the current status of health infrastructure generally in the countries. That's great that we have a lot of things to think about in terms of our future advocacy with regard to which stakeholder to target on, which particular thematic area to pursue from a research standpoint. With this, I would like to open the floor for questions. I would request all the attendees to post their questions in the chat box, and then maybe also mention that who you would like to answer this question. I already see one particular question from Vinu. Vinu is founder of Voice India, based in Tamil Nadu. Vinu has been a long-standing intersex activist, is very closely involved with the current initiative of the Tamil Nadu government in terms of creating policy around inclusion of trans and intersex people. So maybe I can read out Vinu's question. Even medical practitioners don't know about the term intersex fully. Till now, they said intersex baby born as transgender baby. I don't know how a baby born as a transgender. Here in Tamil Nadu, a baby born with 2 reproductive organs and some issues, they died, but the media promoted that a baby died because of a binary reproductive system. I complained to the medical board but didn't get a reply, and the particular hospital released a fake summary regarding this. I can say medical professions are stupidity and zero knowledge what the exact variations of intersex. First of all, we have to update the medical curriculum on intersex variation. Do we have any research on this particular topic? So that's both a mix of a comment as well as a question in the end. It's the representation of intersex people within the media is something it's very complicated subject. We really need to come up with guidelines how media needs to speak about intersex people. It's always sensationalized, it is misrepresented. But yeah, there is one question at the end from Venu, whether there is any particular research on reforming medical curriculum anywhere in the region or anywhere in the world. Any panelists would like to take it?
Well, definitely not in the region as far as I know or I'm aware. There would be elsewhere, I'm sure. I haven't looked into it. But I don't think all our answers lie in research. For this particular purpose, I think it's more important to rely more on advocacy and working with media professionals with the awareness that we do have as different organizations, different activists. So I don't think all our answers lie in research, but also kudos to and their body to be filing this and to register that complaint that this is not okay, and they need to pay attention to that. Thank you for that.
Certainly. Thanks a lot, Venu, for raising this question, and good luck with your continued advocacy with the Tamil Nadu government. I would encourage all the attendees to really watch out for what's happening in the state of Tamil Nadu in India. It is the Madras High Court which actually in 2019 banned intersex surgeries. Conversion practices nationwide have been banned because of the judgment of Madras High Court. Madras High Court is continuously hearing a public interest litigation in which every day we are seeing orders which relate to training of police officials, medical professionals with regard to understanding people with diverse OGS identities. There's a lot which is coming out from the state of Tamil Nadu. So I would suggest everyone to keep an eye on it. There is also a very recent suggestion in which there is going to be a state-level commission on sexual and gender minorities. Now, I'm very skeptical about the idea of any national human rights institution in India because they rarely have any power. They're always like post-retirement jobs for retired for ex-judges. They rarely have performed any major function, but still a dedicated institution, statutory body focused on the concerns of sexual and gender minorities. I think it's certainly a great idea. We all need to see how it actually gets implemented. Are there any other questions that people have here? Please feel free to type in.
Prashant, I think Maman had made another point in the text that we might want to read out.
Oh, sure. Yes, I just now see it. So yes, Maimun has also shared a little bit about the legislative, issues within Bangladesh, which relate to intersex people. Primarily, since 2014, there was a specific Hijra gadget, which was brought out by the government, which recognized people born with sex characteristics that do not fit the typical binary notions of male and female bodies. And it is the Hijra sex, which was a completely controversial definition. Yes, I mean, that's exactly, the issue which is now actually being translated into a law. The problem which lied in a policy document, which it will now become a law, this is something which perhaps Maimun is trying to point out. But yeah, this is what Maimun is saying, that even after this particular policy was passed in 2014 and it talked about intersex people, still nothing has been done to protect the intersex community. With the support of Bangladesh's National Human Rights Commission, civil society organizations have proposed a law to protect the transgender community. Although the Anti-Discrimination Act has been submitted to the government by civil society organization, it has been controversial because it defines intersex, transgender, and hijra under the same definition. Yes, Maimun, this is another, again, same issue which is recurring. Similar mistakes were done in India as well. And even after repeated writing submissions made to the government, nothing actually reached, and this actually made its way to the law. Another comment from Maimun is Dr. Monica from the DSD department of that particular hospital, the eminent hospital in Dhaka, said that every week we receive visits from intersex individuals seeking surgery to lead the normal life and escape the societal stigma associated with being hijra. We assist them in determining their sex through a series of tests and perform sex correction surgeries. These surgeries are conducted only with the consent of intersex child's parent, which is problematic. They prioritize treating intersex children with parental approval and do not perform any intersex surgeries without it. I believe in most cases, intersex children can integrate well into the society and live normal lives. Yeah, there you have it. It's coming from a doctor. Probably Maimun has put this under quotes. Probably it is from a press release or something. But yeah, this is what is being, done in Pakistan. In Bangladesh. Any thoughts you had on that, Mehrab?
Yes. I mean, we all are a gift that just keep on giving. I wanted to say Pakistan is a gift that keeps on giving, because earlier when you were talking about hijra, trans, and intersex being clubbed together in one definition, that is also a gift of Pakistan. And I would also like to implicate the United Nations Development Program, UNDP, and the Global Fund in that, because under their MSA Multi-South Asia Grant, or Project Diva, which was initially known as that, it was under that those efforts to constitute a legislation that can afford civil protections to transgender individuals. And then it's that law that then went into India as well, and then from there perhaps to Bangladesh as well, because this grant operates in all of these countries. So it's just like, how similar we are. But then once again, like there are moments of joy and resilience. Case in point, Tamil Nadu and the Madras High Court. I've been following news. Brilliant judgments have been coming out of the Madras High Court. So it's sometimes fascinating. It's so fun being South Asian because you're Indian and the entire country is going somewhere else. And then there's Tamil Nadu that's going somewhere else. And then you have Pakistan, which is on its own LSD trip, sitting in a corner, hallucinating. And in that LSD trip, Suddenly Pakistan has the eureka moment and it comes with something brilliant, and then it backtracks on it and goes 50 years backward. So I just think as we're coming to a close, I wanted to ruminate on how fun it is to be brown and to be a part of post-colonial South Asia, and to enjoy all of these fascinating roller coaster rides that our countries are on. What can we say?
Thanks a lot, Mera, for those colorful remarks. I couldn't have concluded this any better. And I do want to, certainly agree with you on the point of involvement of international organizations in this process. And we have seen this happening in the region that, a lot of law and policy reform sometimes does happen with the support of international organizations, intergovernmental organizations like the UNDP you mentioned in Pakistan. There is a lot of influence of such organizations in Asian countries. However, it more often than not, it goes in the wrong direction and it doesn't really include intersex people in the process. So that's certainly a very valid criticism of being very cautious, ensuring with regard to the influence of international organizations, but like UNDP, like various other intergovernmental organizations, it's very important that intersex organizations are involved in this process. I see that there are no further questions. Maybe we are also coming close to the end of our webinar time. Maybe I'd like to invite Kim to probably say a few concluding remarks.
Thanks, Prashant. And thanks to all the speakers. Sorry, we had some technical difficulties, but I think we tried to work with them. Very informative discussion, very, a relatable discussion. We're very excited about these reports. This has been an incredibly important project for Egale to be part of. And initially, there were a number of reasons why it was so important. One, because this work is, all intersex work globally is terribly underfunded. So as much as we could bring some funding and leverage that into this space, that was incredibly important. On top of that, work in Asia is also typically underfunded. So we had a double whammy here with intersex work in Asia not being well supported by global funders. But I think as a Canadian organization who has really been doing a lot of work on intersex issues, part of the reason why it was important for us is because we are also facing these gender critical actors, these anti-gender movements, as Mara pointed out. Surgeries on intersex infants in Canada are still ongoing, and we are in an active legal battle with our government on this. So this work is very much aligned with some of our own work in the area, and the research reports, although they're specific to the countries that they were done in, will definitely be useful in terms of our own work in Canada and being able to challenge what's happening in hospitals all across the country in particular. I do want to thank Dr. Morgan Holmes, who was not able to join us today, but who was our academic resident within Egale for most of the duration of this project and worked closely with the team at Intersex Asia. And I also have to thank our funders. Ultimately, this work is funded by Global Affairs Canada through a fund called the Act Together for Inclusion Fund, which is being implemented by Equitas in Canada and also supported by the Dignity Network. So it's important to thank them for this contribution to making this work happen. And I also wanted to point out and specifically thank Samin and Kendall from our project management team here at Egale. Kendall's been supporting us, the technical backup on this, and Samin had the great pleasure to travel and meet Sim and the team in Nepal this year. I unfortunately wasn't able to make it to the consultation in India, but it's been a great project, and we really want to thank the team, Hiker and Prashant, and all of the folks on the call today for a great collaborative effort, and congratulations on getting the reports done.
Thanks a lot, Kim, and everyone at Egale for being a great support for this project. And We hope we get the opportunity to, organize more of these sessions in the future conferences which are happening this year. We certainly need to get the word out about these particular reports and the more which are coming out from Intersex Asia. I would request everyone to keep an eye on the social media channels of Intersex Asia. And if I can also plug in the newsletter that we have been running for the last 3 years, which is a compilation of all important legal and policy developments with regard to intersex rights. We publish it quarterly. Please feel free to sign up on our website. And keep an eye out for all the upcoming reports. With this, I would like to thank all our panelists who took out the time and shared their insights, their experiences of working on this particular project. We had a great time working with each one of them. Our thanks are also due to Adnan Hussain, who authored the Bangladesh report, and also Indu Ji from Nepal, who authored the Nepal report, couldn't join us today, but certainly their reports have turned out really well.
Oh, let's see, Prashant. We've lost Prashant. I don't know, Hiker, if you wanted to say any final comments.
Yeah, okay. I just feel very grateful for everybody's contribution and commitment. Our movement without you is not possible. So thanks for joining us and thanks for supporting us. Thanks for joining to today's webinar. I think we can call it a day here. Thank you.